Folks, welcome back. We are so delighted to have Kelley McBride and Jennifer Brubaker with the Madison County Health Department joining us this evening. Ladies, thanks so much for being here with us.
Thank you so much.
Thank you, ladies.
Glad to be here.
Good to see you.
So, ladies, I know that we have a new addition to the Madison County Health Department. Jennifer, welcome as the Social Services Coordinator for the Madison County Health Department. What a valuable role you are serving.
Yes, thank you. Thank you. I'm pleased to be doing it.
So tell us a little bit about what you'll be doing for the Madison County Health Department, Jennifer.
Okay, so basically my role is to serve those in greatest need and help them get through their COVID quarantine or isolation.
Okay.
So when a case is elevated and they have other financial need or things that they need contact with in the community, resources, I get their number and then contact them and just help any way I can to make this time, their quarantine for their 14 days, just a little bit easier. So, and the needs vary, obviously, so,
Sure.
but it's very rewarding. Of course, I've, been working in the community a lot in the past with different resources. So, and I just want to say Richmond is just full of great resources and people willing to help. And so it just makes my job easier. So I appreciate that, living in such a great community.
So, Jennifer, what exactly is the process? Can you take us through a shortened version of how this all works when you first get the phone call?
Okay, so basically, the contact tracers are the ones that take all the information. A series of questions, and Kelley, please interrupt me if there's something I miss. But basically, they do like a little interview first.
Okay.
And if the person should say, I really just don't know how I'm going to pay my bills, or I'm depressed over this. I don't know where I can turn to talk to someone. Or if they say, I have no food, or I have no thermometer, I have no mask, I have no disinfectant. Then I am called by the nurses at the Madison County Health Department. We're a team, so we are a response team. We all work together. And so they then contact me with the person's information, and I basically follow up with them. And I say, I received your name and you have some concerns and needs, and I am just here to help you make those connections in the community, how we can help you get through a little bit better and maintain your quarantine and maintain your isolation if possible. So I've been working with the food bank to get emergency food kits together. I have been working with some of the area churches to get COVID care kits together. And so if they need a thermometer and things like that, I have a little kit that I can deliver to the house. And of course, it's a porch delivery, no contact, things like that. Also encouraging them, I put a little note in the bag to encourage those folks that we're there, we care for them and their need, and that we appreciate what they can do to prevent the spread of COVID-19. So, and let them know that your community cares about you, that this is from the community. Okay. So it's, gone really well. I've been very busy, unfortunately, but, these people are just so grateful and thankful, and it just makes a better positive attitude for the whole situation. So.
Oh, excellent. And Kelley, I don't know, Colleen, did you have something?
No, go ahead, Randy.
Okay. Well, I think this is just a very valuable resource, Kelley. I mean, to have. This is an extra tool in the toolkit, really. So
right, and to have someone local who's been here in the community and who has given so much to the community, this is where Jennifer shines. And so we are so glad that she's part of our team. As she was saying, and I was thinking back to July and August when our case counts were rising dramatically. And I was not aware, being new to public health, that when our staff at the health department and our contact tracers were making phone calls and communicating to people about how best to have a successful isolation or quarantine, to see what support people needed. When they were hearing those needs, they were themselves reaching out and taking care of those things.
Cool.
And I did not realize that there wasn't really someone that was coordinating all of these things. So as we had more people who were needing to quarantine and isolate, we had more people who had challenges of doing that successfully. Like she was saying, people didn't have a thermometer. Sometimes people had no way to get groceries. So with our social services connector, Jennifer started in September. Did I say that right? Social services connector. Jennifer coordinates all those needs so that the contact tracers and the disease investigators can focus on their job of keeping up with the data on folks and where they are in their quarantine, and then that way Jennifer can coordinate the social needs, and people in the community can help Jennifer. They can volunteer. Church groups, individuals, or organizations can reach out to Jennifer, and I will allow her to share her cell phone number where people can talk to her and see how they might best help her.
Okay, excellent. All right.
Wow. Jennifer, it seems like it is a perfect fit for this role. Such compassion and just this is such a gift that you have. Like Kelley says, you just shine in this arena. So we're so very grateful for you. Now, Kelley, I know that this is a busy month for the Madison County Health Department. Tell us about a few of the things that you have going on.
Sure. I just wanted to touch on 2 or 3 items. The first is flu shot reminders. Yes, we all need to remember we need to get our flu shots. If you have seen Dr. Stack speak on this, he has told us that it is possible to catch the flu and be infected with COVID-19 at the same time. We don't want that to happen. So we are urging people to remember to get their flu shots. And October is a great month to do that. See your primary care physician or your pharmacist. There are so many options out there where you can get a flu shot. And if you have any questions, you can call us at the Madison County Health Department. Right now, we don't have any plans to do a drive-through clinic or anything like that because flu shots are widely available in our community. But if you have questions about that, you can call us. And also, October is Breast Cancer Awareness and Prevention Month. So if you've seen Baptist Health Richmond and some of the other folks that are involved in Paint the Town Pink, that has started. Please go support them in all of their activities. So we are just reminding folks ladies to get their mammogram. And nowadays there's different ways to screen and different ways to treat. So the CDC has promoted a campaign saying one size doesn't fit all. So we want to remind people to do that. Get your mammogram. Again, if you have any questions, you can contact us at the Madison County Health Department. And we can maybe guide you through a process or direct you to a caregiver that can help you and further answer your questions. The last thing that I had on my list was the community health assessment, the CHA, and the CHIP, the Community Health Improvement Plan, that we still have that link open. It will be open through October the 9th. We've recently had a little bit of a hiccup. If it says that it has expired, they are working on extending that expiration date. So you should be able to reach that link, and it's a bit.ly link. You should be able to reach that through October the 9th.
Okay.
So to access that, you can reach our website, MadisonCountyHealthDEPT.org. You have to scroll down a little bit on our webpage, but you'll find the links to there's a presentation, a video presentation, and then a survey, a brief survey to take. So I want to give a shout out to the Richmond Chamber of Commerce and Mindy Goebel. She has been spreading the word of the opportunity to participate in the survey, and I'm thankful for that. And I think some people have had some difficulty saying that the link has expired. Just keep trying. Go back and try.
Just keep doing it. And that's and that's until October the 9th. Is that correct?
Then through the 9th, yes.
Okay. Excellent. All right. That's fantastic. Oh, Jennifer, what is your phone number, by the way? So I want to get that word out there because I want to make sure I have it right.
Yes, it is 502-682-9803.
Good. Excellent. And people, if they have any issues, any questions, they should call that number.
If they want. Yes, Jennifer has the answers to everything. No, she's good. She's good.
Well, Jennifer, I may call you this week.
That's right. We expect
Just say, Jennifer, how are you doing? You need some coffee?
I'm sure she could use your assistance, Randy.
I know she probably has a question now. Jennifer, sometimes my light goes off because I forgot to turn it on because it's a motion sensor light. So if you see me back here going,
He starts waving his arm.
sorry.
That's what's happening.
Or it's a fly. Could be a fly.
Could be one or the other. Ladies, thank you so much for everything that the entire team at the Madison County Health Department is doing to keep our community safe and healthy during this time. We greatly appreciate you.
Thank you for having me. Thank you so much.
Thanks, guys.
Thank you, ladies, for coming on. I really enjoyed it, and a lot of great, good information.
Okay, great.
You bet.
We'll be right back after this.
This message is brought to you by the Madison County Health Department. When it comes to breast cancer screening and treatment, one size does not fit all. Some risk factors put women at higher risk for getting breast cancer. Having a risk factor does not mean you will get the disease, and not all risk factors have the same effect. Talk to your doctor about ways you can lower your risk for breast cancer and schedule your mammogram today. If you have questions, call the Madison County Health Department in Richmond at 623-7312.